if we notice that somebody's feeling that way about themselves, or they can say that to us, it is our part of our job to, one, explain to them that they are worth everything they are, and it's okay that they feel the way that they feel.
Yeah.
And we should be encouraging them to see their doctors outside of us. Like, it's our job to help them get the other care that they need outside of their dental care. And that's just part of being a good clinician in general. But this, all, like I said, this is very comprehensive care is in all facets. So mental health, physical health, oral health, they all play that huge role because it's the whole body. Welcome to Dental Hygiene Development. We invite you to listen along as we discuss everything dental hygiene, from personal and professional development. My name's Autumn.
And I'm Paige, and we're just two best friends discussing what we love to do. Grab your favorite Diet Coke, Diet Dr. Pepper, maybe a glass of wine, and join us as we discuss anything dental hygiene.
Hey y'all, welcome back to Dental Hygiene Development. I'm Autumn and this is Paige. We're so glad you're back with us. We are diving into comprehensive patient care today.
Yes.
I just said to Paige and Chad that I could go long on this one, so I do apologize. I'm going to try to keep it short.
I'll reel in.
Yeah, reel me in because I'm so passionate about comprehensive patient care.
Passion is good though, so.
It is. If you ask one of the things that I'm super passionate about, leadership and comprehensive patient care. Yeah. Because I think that there are so many things that we can do for our patients now. Like the options are endless with things that we can do for education for our patients. Yeah. And most of us have the access to all of these things.
Yeah.
And we know the reason that we should be doing it, and we're not doing it because we're either lazy or we're running behind on our schedules or we don't schedule enough time, or maybe we just haven't really thought about the importance of it, but our patients deserve comprehensive patient care.
Right.
Absolutely. At the end of the day, the whole reason that we do this is for our patients, is to make sure that they are healthy, they have everything they need. And I think I used this analogy in the last podcast, but for some reason everybody in society thinks that your head is sitting beside your body.
Yeah.
But I think thankfully there's been more research and people are finally getting it out there that everything is connected.
Yep.
And if we are not the ambassadors for explaining this importance, like oral systemic link to our patients, who's going to be? Nobody. Yeah. Do you know how excited I was? I went to the doctor, to the gynecologist, TMI, but I went to the gynecologist this week, and there was a sign on the back of their door, and it said something like, oral health is important to your baby's health. And I was like, oh my gosh, this is so great.
Wonderful.
This is so exciting. I was so exciting about it. And it came from Oral B. So thank you, Oral B, for reaching out to the gynecologist and putting it out there. Because a lot of times, unless we see patients who are in their pregnancies or thinking about pregnancy, and we don't know. So we're not asking our patients, their person is like, are you having a baby? What do you, blah, blah, blah. That's not, unless they tell us.
Yep.
So we don't know how to prep them for it.
Yep.
And then I'm in this, especially with, pregnancy, I'm in this, I don't want to stress my pregnant patients out by if they're pregnant and they come in and you're like, so you have this gingivitis or you have this periodontal disease. If we don't take care of it now, you could have preterm labor, your baby could have all these birth defects and they will freak out. So you have to be very careful in how you approach these things, because I know I haven't had a baby yet, but I can only imagine the things that you're thinking when those things are happening.
Yes.
So you have to be careful what you're saying, but just the fact that we have more education and that other people are putting it out there, and it's not just the dental health profession that is saying it, it's other professions that are saying it. Praise the Lord, hallelujah.
Yeah, because I think it takes people so many times to see something or hear something to actually take it in and take it serious. So it's great to hear it from another trusted medical professional other than your dental professional. But specifically on pregnancy and patients and hygienists who get pregnant, I feel like we have a long way to go in pregnancy, education and studies and information and just how much it does affect it. We know it does, and we have certain information, but it's one of those areas I think that is lower on the totem pole. So it's really important to educate yourselves on that. And that will actually be included in one of our continuing education courses. We're going to kind of dive into some of that. So you guys keep being on the lookout for those this year. This is a good time to say we do have our email list. We won't spam you or anything, but it's literally just to let you know when we are launching important things, like when the continuing education courses come out, we'll shoot you an email of how to participate in those if you would like, that kind of thing. So it will be linked in the description. You can just put your email in. It's private just to us. And we would love to keep you up to date with that type of thing. But I'm like super passionate about that now, since I just had a baby. So I was a pregnant hygienist, but I also was a pregnant person who needed dental care. Yeah. And so I think it like sparked a new like passion for me and that type of thing. So yeah, anyways, that was my weird tangent. But
no, that's a good tangent because it's so important. Like if we're not comprehensively treating our patients, you know, how are we going to delve into all these things? And there's not just pregnancy, but there are so many systemic links that are involved that we're seeing patients on every day who have these things. And we have to be able to help them cope with it. And we have to be able to help them realize the things that are going in their mouth, if we get them healthy, can help them in their bodies.
Yes.
And the only way that we're going to get this information out is to be comprehensive.
Yeah.
I mean, you can't halfway do anything and be good at it, right? And so this is important things. Like these are, I mean, people don't like to think that what's going on in your mouth is life or death, but it truly can be life or death for some people if they're not managing their systemic health and their oral health. The things that they do, just the smallest things they do in their mouth, could affect the things that are already going on in their body.
Right.
And wouldn't you hate to be the person who you could have been like, man, if I had just talked to this patient a little bit more about this, or educated him a little bit more like this, it might not have been like that. And I don't want to be over dramatic. I'm not trying to be.
No, but it is important.
It is so important. That's why it's important to me for comprehensive care for our patients. And there's so many, like I said, there's so many tools that we can use now.
Well, it's also like you said, like you were super excited to go to the gynecologist and see something about oral health. I think that door swings both ways. Like when we pick up something that is like medically related to oral health, that we bring that up as well, because again, the more patients are educated and see anything health-wise, the more compliant they're going to be all around. You know, they're going to understand what's going on and take charge of their health, you know, whether it is their diabetes and their oral link to their diabetes. So, yeah, I think it's full circle for sure in the medical field.
One of the hardest conversations I ever had to have with a patient was somebody that I knew. It wasn't like an immediate family member, but it's somebody who I was kind of close with, but I hadn't seen in a long time. Yeah. And they came in and they had advanced perio, and they had missed like over a year between appointments. And when they came, they were coming because they needed a medical clearance so they could have back surgery because they were in so much pain with their back surgery. And we were discussing when they came in, they had mobility on a tooth, and the perio had increased significantly in that time period. And when you step back and you start asking them questions, not only are we unable, like at this point, there's not much I can do. Like they're going to have to go see a periodontist, right? But I also have found out that they may not be able to have their surgery because they had pre-op like blood work done, and their diabetes was completely out of control.
Yep.
And it was going to hold them back. And so then when I was trying to explain the correlation between their systemic health and their oral health, especially with the diabetes connection, like it was all connecting for him. And it was all connecting him that he hadn't been taking care of his diabetes and had done more than just, now it's, you know, I'm not going to be able to have this back surgery because I have this active infection and because my numbers aren't under control. And it all was like a huge play together. And you could tell like it was sinking in. It was a really hard conversation to have because I felt terrible for this, you know, for this person who I knew and I already had a relationship with outside of being a patient. And we have to delve deeper. And I think one of the biggest things, the first, very, very, very first thing in comprehensive care is a comprehensive medical history.
Absolutely.
Like,
it's super important.
Super important. I mean, you can't go anywhere through an appointment and do anything else if we are not documenting everything that we do. Mm-hmm. And it starts with you will have patients that will fight you to the death on giving you their medical information. And they're like, it doesn't matter. It's not like they're in pain. It doesn't matter. Like, what I'm doing is not this. And you're like, but it actually does matter. And you have to explain. And when you can finally break those things down over time, or you have patients who have their mouth is just completely bombed out and they tell you that they have like lupus or they have some autoimmune disease. And you can start relating all the things that your body is fighting against itself. And I'm sitting here thinking about the slip and slide method and their dry mouth, and it's not like it's not all connecting together. And like then it starts to click for them too. But I think until we really start explaining to patients why. I think it's anything that we do for patients, we have to explain the why, because they're not going to understand why it's important for us to do that. But the medical and previous dental history is super important, because we need to know what they've had done in the past. And not only is it going to tell us what's going on in their mouth and maybe in their body, but it's also going to give us an insight into how they feel about the dentist already. And where their mind is when they come in. So that is the easiest way to start off comprehensive care, is finding out that medical and past dental history.
Absolutely. I mean, I feel like it really does come down to being a simple question, like asking your patient, like diving in. And one thing I like to do when we're looking at medical history is like mental health is a important part also, because people may not feel like taking care of themselves if they're struggling with depression, or if they're grieving, or there's a lot going on in their lives. So sometimes just simply telling them, acknowledging what might be going on behind the scenes, of like saying, what do you feel like is holding you back from being able to do these things at home? And listen to what they say, because then you can maybe come up with some ideas to help them get over that hump of whatever it is holding them back. Whether it's, I'm depressed and I don't feel like worth taking care of myself, well, you can encourage them that they are worth it, and that might help. Once they feel better physically, that might help mentally kind of get them out of a fog. Just different things. When you specifically just ask the patient and say, well, what is it you feel like could be holding you back? And there's going to be a wide range of answers, and then it gives you a direction to go. So,
and then that mental health thing, like if we notice that somebody's feeling that way about themselves, or they can say that to us, it is part of our job to, one, explain to them that they are worth everything they are, and it's okay that they feel the way that they feel. And we should be encouraging them to see their doctors outside of us. Like, it's our job to help them get the other care that they need outside of their dental care. And that's just part of being a good clinician in general. But this all, like I said, this is very comprehensive care is at all facets. So mental health, physical health, oral health, they all play that huge role because it's the whole body. So I think I'm just trying to run in my head. This is what's going to keep me on track and not keep y'all here for like 3 hours is how I run like what I do in an appointment, like in our comprehensive appointment. So the next thing after we do medical and dental history is we take x-rays. And I have a sign, and if you want it, let me know, or maybe we'll just link it. It's it's an Etsy sign, so it's a digital download. It's super cheap, and we just framed it. And I forget the exact wording, but like it basically says we don't guess with your health, and basically is saying that if we're not taking an X-ray, you're just guessing what's going on underneath there, and truly you are. If you're not taking an X-ray, we have no idea what's going on underneath there. We can take a guess. And we can take a pretty educated guess because we've been doing this a long time, but we truly don't know what's going on underneath there without taking an x-ray. And we shouldn't take any of this for granted or make an educated guess on anything, especially when we have the tools. I'm not saying you need to take x-rays every appointment, because obviously there's protocol and there's things that we do and when we should take them, but I'm a super advocate of not letting patients deny x-rays.
Absolutely.
Even with a written notice, because one, I've heard from, and when you go to C classes, that they are saying that even if they're signing a decline form, you're still responsible because you are the person, they don't know, but you do. So that's not holding up in court. One, so document yourself.
They can still sue you.
CYA. But at the same time, it is literally us guessing.
Yeah.
Taking a patient's health. We're just sitting here talking about how important all this stuff is in someone's
Yeah.
mouth, and then we're just going to guess what's going on underneath there.
And that's one of those things, too. It kind of circles back to, educating the patient. A lot of people are just scared of x-rays. They think they're going to turn into
Oprah.
the green frog or, like, the Hulk or something. And you tell them, like, technology has advanced. This, I always tell people, like, a day or two outside in the sun at the beach is way worse than your whole year's worth of x-rays that we're going to take here. And usually when I compare it to something like that, I'm like, you can go out and mow your grass and it's worse than me taking this PA, like as far as radiation exposure and whatever. And I even also tell patients now that, a lot of places have taken away the requirements for the lead apron. Like, you don't always have to put a lead apron on a patient when you're taking x-rays because the exposure is so low. So I will tell patients, I'm like, they've changed those regulations because the exposure is so low. Now, we still use them because why not? It does help. So you're, even safer. So once you usually just tell them things like that, then they're on board. And like you said, tell them, like, we don't want to guess. It's kind of like if you went to the doctor and your arm was broken and they didn't x-ray it to see where it was and they just went into surgery blind. Like, you don't want them to go crazy.
Exactly.
So you just have to put it into perspective for them, and that's part of your job. It's to put it in a perspective that they can understand that doesn't make them mad of just like, well, you don't have a choice. Like, you can either take them or leave.
That's not how they go about it.
And I've seen it happen before, over and over again, where patients and clinicians are, like, arguing, and it turns into this whole thing. And I've actually had to go in as lead hygienist at one of my offices and
break it up.
Yeah, break up the situation and kind of talk the patient through it. So it can be challenging. It really can. It can take some practice. But you do have tools in your tool belt that you can use to get a patient to a place of letting them let you comprehensively treat them.
And most of the time they're scared because they've heard all these crazy things about radiation, and you should break it down with them and let them know those things, like, what we're doing is not that much radiation. But you should also try to remind them that here we are trying to be advocates for your health.
Right.
We would never do anything that's actually bad for you.
Right.
Like, we're not going to do anything that we knew would be that would compromise any of your health stuff.
Absolutely.
And that's why it's important that we take a comprehensive medical evaluation, because if there is some reason that they shouldn't have radiographs or they shouldn't have something that we're doing, we do that first. That's why we do that very first thing.
Yeah.
So we've already reviewed all these things to know if you would not be a good candidate for this and if it's truly going to harm you. And if it was truly going to harm you, we wouldn't do it.
Yeah.
So you just need to confirm that with them and remind them that we are here for the benefit of your oral health.
Right.
Yeah.
And on that note, I'm going to this will be a small little tangent, but in comprehensive care, we're, as clinicians, taking FMXs. And I don't know what is happening in the world, but an FMX has 8 periapical pictures in there. And I see a lot of hygienists, and I hope that this is just like a time constraint type of thing, but they'll take all 8 PAs, and you cannot see one apices or a root tip where you're looking for, abscesses or lesions and stuff. And so there's no point. You are exposing that patient to radiation for no point if you cannot see above the root tip. So I encourage hygienists, like, if you don't know how to get those PAs, go and ask someone,
or don't take them. I mean, heck.
Or, don't take them. Do your bite wings and your anterior PAs.
And ask someone else to do them.
Take a pan or go get somebody. Don't be afraid to ask if you don't know how. But also, you are doing a disservice to your patient. That is not part of their comprehensive care for you to take those x-rays and they're just like checking a box of like, okay, they're in there, but they're not diagnostic. The whole point is to be able to diagnose.
Absolutely.
So take that kind of responsibility on yourselves. I really want to encourage hygienists to do that, and I know that it can be challenging sometimes with our schedule, the time on our schedule, but you do have to pay attention. If you're doing something, do it to the best of your ability, and if you know it's not up to par with what you need for that patient, go get help. A lot of the times it does take 2 hygienists to get a PA, on a gagger or whatever. There's all kind of things, but go ask for help to make sure you are comprehensively, treating that patient and doing what's best for them. And so if you make a note, this goes back to documenting well too, like make a note, this patient is hard to take x-rays on, you may need help. So put them in the schedule in a certain place to where you have time to do that. But yeah, I definitely, that's one thing that is kind of one of my pet peeves that I see a lot is like, we've taken this FMX, it'll be sent from another office, and you're like, well, I can't see what I need to see, so now I have to have the conversation with the patient that it needs to be retaken, and then they don't understand why, and it's hard. You know, you don't want to say like, well, their x-ray sucked and I can't see it. Yeah. Like, they did you a disservice. You know, you try to be professional and not say that, but you do have to kind of work around it in a way of saying like, well, we just need to see a little bit further and make sure there's no infection, yada, 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 you know. But it all comes down to like working together as a team of dental hygienists and saying, I'm providing the best care I can for this patient.
Yep. That is part of comprehensive care, is doing it the right way.
Right.
Yes.
There goes my blue temperament popping off. But, I mean, I do think it's important. You know,
it is very important.
Very important.
Yes.
So, yeah.
And then after we go x-rays in my office, the next thing I do in Howard my appointments is I do a dental health scan. We call it a dental health scan, but it's really just a digital scan or an iTero. We use iTero, Trios, any of the scans, or I would say intraoral pictures.
Yes.
This is all that vein. Like, if you have that technology in your office, you should be doing it for everybody. That's why in my offices, we don't just use the iTero scanner for people who are going to get Invisalign or they need some restorative treatment that we're using the scan for. Every recall patient should be getting one every 6 months because there's so many tools that you use for education.
Absolutely.
Most patients, they see it and they believe it. So we should show them, if you can show them the radiographs and there's something on there that they can understand, like calculus, or you can show them bone levels, those kind of things, show them. So the same thing goes with that intraoral pictures or intraoral scan. Like, there is no better thing than seeing is believing. Like, you should take that because, and we don't charge patients. I mean, that's up to your office, you know, where what you charge for and, you know, what you do. But we don't charge our patients for dental health scans. We just do them because we believe in comprehensive patient care.
Yes.
And if they see it, they believe it, and then
they're going to come back.
They're going to come back for their treatment,
which is where you're going to make up for that income or, you know, production there.
Exactly.
Patient treatment. But also visually, people have a different vision of like, okay, you have a cavity. Like, people don't really know what that is visually. It's like, okay, is that a pinhole or a pothole? Like,
yeah, exactly.
You know, like, they don't know. And if you show a patient an intraoral picture, 99% of the time they're like, whoa, like, that tooth looks so bad. You know, they're like, they had no idea, you know, and it does. It's like close up. It's like seeing something like, woohoo, there it is. No denying it.
And you should use them between. So, like, if you take one at every appointment, like if someone hasn't done a crown or a filling that they need to do, and you can turn around and show them the difference.
It was a pinhole. Now it's a pothole.
Exactly. So that's just giving, like, literally showing them. I always tell them, they're like, why is this important? You are taking an x-ray. We don't take an x-ray every time. We take x-rays once a year, and we do this every 6 months because we can show you if there's any change. You can't read an x-ray. Patients don't know how to read an x-ray, but they can look at a picture and understand, like, that tooth is bombed out. So you can show them that was a pinhole, now it's a pothole. You know, like, these are things that we have in our disposal now, and not every office has them. I would encourage you that if you don't have any kind of these tools, even like a intraoral camera like tool to use, you know, it's definitely something to look into. And if you're passionate about comprehensive care, like really getting with your doctor and going over the why this is important to have something like this in your office to be able to comprehensively treat our patients.
Right.
So once you have an x-ray and a visual picture, the next thing I do is we offer an oral cancer screening. Now, there is all types of oral cancer screening. And this is the free head and neck one, so we should all be, you know, checking. Obviously, anytime a patient's in our office, we should be looking in their mouth and all of their areas, the vegetables, like making sure we don't see anything with the naked eye. But thankfully, in my practice, I have Oral ID, which is the one that we use. I've also used Veloscope. I've used Visalite, all those different types of things that they have now to be able to check underneath the tissue.
Yep.
And I always explain that to my patients. Like, of course, we give them a list of things that put you at higher risk for oral cancer.
Yep.
But we know that the studies show that 1 in 4 people who have they're not smokers, they're not drinkers, they don't have HPV, like none of those things, they still get oral cancer. And it's just like any other cancer. We can't explain everything yet.
And you don't want to mess with oral cancer. Usually they're not fun.
No, they're absolutely not. And if you can catch it early,
Yeah.
the better. So
Yes.
we offer that. And yes, we do charge for it. So whether they get it or not is up to them.
Yeah.
But at least once a year, they should be, every time they come, we should be looking.
Right.
But if you have something that you can offer extra, like a oral ID or a Invisalign or a Veloscope, we should be making sure that we're at least talking to them about it every time they come in. To
Yep.
me, I talk about it every time they come in, but they sign something at least once a year. So we know that for us, to me, the documentation is really about me remembering if I've talked to this patient about it.
Right.
Right? So that's that important. And they get to decide if they want to know. I'll be honest with you, I have patients that'll sometimes say they don't want to know.
Yeah.
Like a lot of people be like, I'd rather not know. And that is their prerogative.
Right.
But if it were me or my family member, I would want to know.
Absolutely.
So that's why I offer it. And it's another tool that we have in our tool belt. That's just something that dentistry has evolved with.
Yep.
So that's a very quick and easy one that we should all at least be doing the, visual looks and feeling
Like
and
the bare
palpating.
minimum.
Yeah, we should be doing that. And then periodontal charting.
Oh, perio charting.
Woo, boy.
Lord.
Get me on the tangent.
I know.
Right?
Well, it's funny because I feel like recently we've had a good bit of changes in the periodontal classifications and all of that good stuff, like the guidelines. And I don't think a lot of places have transitioned. I know I took over at an office. I was the only hygienist, and I talked to our dentist. I was like, all these patients, they have been perio charted, like they have their basic numbers, but like the recession and all of those things hadn't been charted correctly. So everyone's charts there were numbers in there, but it was done wrong. And if I would have went back and started redoing it, it would have really messed up all of the charting and stuff. So I had a conversation. I sat down with him, and of course he was like, whatever you can do to get it up to date and better help our patients, let's do it. And so I was like, all right, I'm going to need time in the appointments to be able to do that. But he was totally on board. But, and it may take time to transition to stuff like that.
Yes, and it's going to take time. I mean, I would say that, again, it took a while. And when we launch courses, the new AAP guidelines is something that I talk about, and it's a lot. The first time that I had a CE about that, and it was 2018, literally 2019 when I had that CE, so it literally just come out. It was so new, and when you're taught something a completely different way in school, when you come out, whew, that's a lot. So it was a lot to take in, and you're not going to change overnight.
Nope.
But the good thing about this is the AAP has great, resources that you can print out and keep in your operatories where you're going to be doing it, so you can reference back. And the more you do it, obviously you won't have to look at those guidelines, but at first it's very helpful.
Yes.
Because again, the AAP is taking into account for all the oral systemic things that our bodies are taking in and how it's affecting. And now we're using that to grade perio, which I think is amazing.
I think so too.
Because it's not just looking at it from do you have calculus? I mean, when we're in school, we grade our cleanings on classes because of how hard it's going to be for us to clean their teeth. We're not truly thinking about the support structure that's going on underneath and the systemic links that are going on, because you're literally learning how to clean teeth, right? So that's what matters. But I mean, this is huge, and it helps us find what's going on and the types of bacteria that are in people's mouth, and really explain to patients that grading system is really going to help patients understand how the things that they're doing every day affect their oral health and how those things correlate.
I love that it's in stages,
Yes.
I feel like people take it more seriously when you talk to them in that way. So, and that's what we need with perio. We need people to take it more seriously, because they kind of just it's fine. I'll go home, floss some more, no big deal. But really, we know it's
my pet peeve is when, and I always tell patients this, and you may say it, and sometimes I have to keep it, but anytime that I see bleeding and someone says, oh, you just have a little bit of bleeding, you just have a little bit of bone loss, you just have a little bit of infection. What is a little bit and a lot of bit? If you downgrade that, patients, or if you say you have a little bit of bleeding, the patient's just oh, it's just because I'm not flossing, so I'm going to go home. No. Bleeding is not normal. We discussed this in the last time. There's a reason that is there. So we should be treating it and explaining to the patients why it's there.
Yep.
And so bleeding is not normal, folks. Okay? You know that. I know that. So why are we letting our patients think that?
Yep.
So this starts from educating our patients for the very first time they come in, and they might be like, why are you doing this? Or why are you doing this every year? When it's a normal patient, like a healthy mouth, I do it once a year.
Yeah.
Because it can change. And it can tell you a lot of what's going on in their systemic health too, because what happens if overnight something changes?
Yeah.
Or in the last 6 months something changes? What's going on with their systemic health? Maybe they didn't go to the doctor. People don't like going to the doctor. People don't like going to the dentist.
Yep.
So
That's true. Hallelujah.
so if we're not truly getting in there, we can't help them.
Yep.
And then it's our fault when it comes down and they lose a tooth in the end. You know, what were we doing if
And
we
then
weren't
they're
doing
like,
every
why'd
time?
I lose my tooth? Then they're angry.
They're angry. Like, we could have helped you. So we should be doing this, and we should be doing it frequently. I don't care if you have to add 10 minutes to your appointment time to comprehensively treat your patient, to take a dental health scan, to perio chart properly, to take your x-rays, to do an oral cancer screening. If you have to add that time to your appointment, it is well worth it.
Very much.
And if your doctors don't believe it, they will have, I don't even know, like, contact me. I will help you figure out and tell your doctor why it's important. Because at the end of the day, if you comprehensively treat your patients and you educate them well, they're going to want to do their treatment.
Yep.
So if you are spending longer on an appointment time, but they come back to do that crown, do you think your doctor is going to be happy about it?
Yeah.
Absolutely.
Absolutely.
It makes up for that. Comprehensively treating your patients and taking longer I'm not saying that you should need 2 hours for every appointment. That's not the case. They don't need all these things at every single appointment. We should be doing them regularly, and we should have a schedule. And, you know, I have so many things that I can go off and talk to you about, like auditing appointments and doing all those things. Yeah. But, like, part of comprehensively treating patients is also going back into their chart and saying, okay, last time they had this and this. We know that they still have a DO that needs to be done on 12 and a crown that needs to be done here, an extraction that needs to be done here, and bringing it back up, because that is comprehensively treating them.
Yeah.
So we should be bringing all these things up every time a patient comes in and connecting them.
Yep.
Because it's for the patient's benefit.
Yeah.
It is our job. It is our duty to make sure that we are doing these things and that we are getting the patients the care that they need.
Yeah.
And we should take a little bit longer to do it. And I think if you truly get the why and you're passionate about it, your doctor is going to understand why you might need a little bit longer.
Yeah.
And it doesn't take forever to do all these things, guys. You're going to get faster at them, too.
Yeah,
but
and
it's
like you
important.
said, if you take the initial time at their new patient appointment, get a very good baseline, moving forward, it should flow pretty quickly. You know, you can rotate appointments with things that you're doing, and yeah, you can figure it out pretty well. So
yeah, and perio charting, like kind of what you kind of mentioned earlier, it shouldn't just be, probing depth thing. We should be doing CAL. We should be doing that. We should be charting BOP. We should be charting mobility and furcation. Like, all those things are important to the patient's overall health. And you might not have to, and even if I will say, I don't chart all of those things at every 3-month appointment for our perio maintenance. I'm monitoring it, but that should be done at least once a year. That is part of a comprehensive treatment plan for a patient.
Yeah.
And those things need to be there, not just, and yes, they're CYA. They should be there for documentation purposes. But it's really about treating our patients the way they should be treated.
Well, too, now as well, there are codes that you can use when you are doing those comprehensive, like, perio chartings that you can charge out, essentially, that we didn't used to have either, which I think we have on schedule for either a podcast topic, kind of some coding to document your work that you're doing, because let's face it, if you're doing the work, you deserve to be, somewhat compensated for it fairly.
Yes.
So there are ways that you can input that so people know that you're doing it and that it has value. But yeah, so there are codes and things that you can use, which we'll talk to you about in a whole nother topic.
And I better, we probably should end now, because if we don't, I'm going to continue to, go down a rabbit hole about all these things. But this is truly just the beginning of the steps that I use for a comprehensive patient exam and every time that I see somebody. But we can break these down into further each thing. Like we can break each thing down further for comprehensive patient care, and we'll do that. And I know we're going to talk about it. Like I said, I'm pretty sure there's a course about it.
Yeah.
And we're going to talk about it in future podcasts. But if I missed anything, call me out because I need to know. And if you have any questions, of course, like I said, reaching out. And I know I want to do a podcast and a course about, making sure you have communication and support and your doctor and hygienist are on the same page. And I know that can be a huge barrier for a lot of hygienists, that you are very passionate too about comprehensive care and what you're doing, and your doctor may not be on the same page. You can reach out to me separately, and I will definitely try to help you, do those things for you. Help you find some ways that maybe, strikes your doctor, and gets them lit up and passionate about you too. But just know that it's definitely something that we're going to talk about, something I want to talk about. I want to make sure, because that can be a huge barrier. So I know those things are out there. So don't get discouraged, but just stay passionate. Do what you can for your patients. Treat them. And
know that it's making a difference. It matters.
It does. And they will come back and see you if they feel like you are doing the right thing towards them, and that they're going to trust you.
Yeah.
And I mean, everything that we've talked about the last few podcasts is about making sure our patients understand.
Yeah.
And they really, truly, we're connecting with them and communicating with them in the way that they need to be felt like they're communicated with. And that's just the number one thing that we should all be focusing on, is connecting with our patients and making sure they get the care they need.
Yep. And it's good to just bring that back into perspective, because there are lots of daily stressors in the dental office that can kind of get you off track with what is important in the day-to-day, and that comprehensive patient care is what you're there for. That's the point, helping people. So
it is.
Yes.
All right. I hope I didn't go on too much of a tangent.
No, you did great. It was really good. Nice, clear, concise. I loved it. It was really good.
I had to use my hands.
That's
And
right. You had your mental checklist.
Yeah, I did. I had a mental checklist and use my hands. That was my.
Tell her in the comments, you guys, she did awesome.
All right, guys. Well, thank you for joining us again.
You.
Again, make sure you you subscribe, share everything with us. We truly appreciate the support that you're giving us, and we want to continue to use that platform to support you and everything you need. So we look forward to seeing you all again at our next podcast.
Yeah.
Bye.
Bye.